You've seen your GP for a medical problem and they've referred you to Homerton Hospital to see a surgeon. This short film aims to give you an understanding of what to expect as a patient when coming in for an operation. Once your GP has referred you, you'll receive an appointment letter to come to one of our outpatients departments where our consultants hold their clinics. This may be at Homerton Hospital or maybe at another site, so check your letter carefully. If your appointment is at Homerton, on arrival at the main entrance, head towards the outpatients department and check in at the reception. They'll tell you where to wait for the doctor. While you're waiting, the nursing staff will take your blood pressure and other key measurements. Your hospital consultant will talk to you about your health problem, examine you and discuss with you possible treatments and any tests you'll need to have. It may be at this appointment or at a later appointment after further tests that the decision is made to go ahead with the surgery. Many surgical cases can now be done in a day and you can be home the same evening. Sometimes you need to stay in for a few days to recover. Your consultant should be able to tell you at this appointment what will happen with the surgery, including how long your stay will be. You then need to be seen in the pre-assessment clinic. You'll usually go there straight from your consultant appointment, or if not, you'll get a letter in the post.
You must attend this appointment to make sure you are fit and well enough to have your surgery. Our nurses and maybe an anaesthetic doctor will ask you about your general health and any medications that you are taking and discuss the most suitable type of anaesthetic for you. The nurse may do some tests. These may include your blood pressure, a blood test and a swab for common infections such as MRSA.
Let us know if you have any concerns about how you'll manage after your surgery. For example, if you feel you'll need support after you're discharged, or if you're the carer for someone who will struggle while you're in hospital, we can help you prepare and work through any potential problems before you're admitted. Unless you're an insulin-dependent diabetic, you'll be given 2 pre-op lemony, sugary drinks to have on the morning of your surgery. These help prepare your body before surgery and speed up your recovery afterwards. You may also go to a group education session or see a specialist nurse, depending on the type of surgery you're having. Once you know you're having surgery, you need to start preparing. Get yourself as fit and healthy as possible. Check your blood pressure is normal, and if you have diabetes, check it is well controlled. In the lead up to your operation date, it's important that you eat and drink well and do some exercise. If you smoke, try and cut it down. Stopping smoking for even a few days before your operation can significantly improve your healing afterwards. Speak to your GP, practice nurse or the nurses in the pre-assessment clinic if you need advice on any of this. You probably won't feel like doing much cooking or cleaning after you leave the hospital, so get yourself prepared before you come in. For example, get meals in your freezer that are easy to prepare. Clear any clutter from your house before you come in so the place is clean and tidy.
Yeah, are you still okay to pick me up after my operation?
On the day before you come into hospital, confirm you've got someone to collect you on your likely discharge date. Pack some nightwear and comfortable clothes and shoes to wear on the ward. Loose-fitting clothes are better in case you have any dressings, drips and drains. Well-fitting shoes that are easy to get on and off will help you walk around. Bring any toiletries you need for a few days in hospital. Have a bath or shower and remove any nail polish, false eyelashes and piercings. Don't bring any jewellery or valuables with you. Don't shave near the area that you're being operated on for up to 3 days before your operation.
If you are having a general anaesthetic, you need to be aware of when to stop eating and drinking to make sure the anaesthetist can get you to sleep safely. Eat normally on the day before your surgery, until 6 hours before the operation. That means you can eat until 2 a.m. for a morning admission. After this time, don't eat anything, and this includes milk and even chewing gum. The only thing you can have during this time of fasting is plain water, and that is until 2 hours before your surgery. It is good for your body not to starve for longer than is necessary, or it takes longer for you to recover. If you are having weight loss surgery or surgery on your bowel, follow the instructions given to you by your surgical team.
On the day of your procedure, drink the 2 sugary pre-op drinks provided for you by the pre-assessment nurses 2 hours before your operation. Follow the advice you were given about which medications you should take before surgery. Make sure you bring your medications with you, or at least bring your most recent prescription list with the doses detailed on it. Arrive at the surgical centre on the time stated on your letter. It's on the first floor on the green corridor. There are signs and maps all over the hospital to help you get to the correct place. At the surgical centre, the nurse will come out to meet you and take you inside. Unless special arrangements have been made for them to stay, anyone who came with you will need to wait outside until you've seen your surgical team and you're ready for surgery. In a private cubicle, you'll undress fully and put on a gown. If you've not had a bath or shower in the last day, please let your nurse know. You'll be seen by your nurse, your consultant, and your anaesthetist. It's at this time you'll be asked to sign a consent form to confirm you're happy to proceed with the surgery. There are normally several operations going on during a morning or afternoon session, so you may have to wait a while to go into the theatre. If an emergency operation comes in, your surgery time may change. We'll try to keep you fully informed of any changes. When it's time, you'll be taken to the operating theatres. You'll be met by a nurse in the theatre's holding area who will run through a checklist with you. When the team is ready for you, you'll be taken into the anaesthetic room and given your anaesthetic ready for your operation. You'll be given some oxygen through a face mask and we'll have a cannula which enables us to give you medication. We'll remove this as soon as possible after your surgery. Your surgeon will make as small an incision as possible for your type of surgery. This might be keyhole surgery or might involve a cut or incision. While you're under anaesthetic, we'll keep you comfortable and monitor you closely, so when you wake up, you'll feel as well as possible. After the surgery, you'll go to a room called recovery. This is where you will wake up. The team there will monitor you until you're ready to go to the ward. The anaesthetist will ensure you have appropriate painkillers and anti-sickness medication in case you need it. Once we know where your bed will be, the staff in the surgical centre where you started the day will bring your belongings to you. There's a lot of activity during the day on a surgical ward. There'll be a named nurse in your bay who'll be looking after you and the other patients in your area. The sooner you get moving, the better. You won't feel like it immediately, but it's important that you move so you don't get complications like pressure ulcers, also called bed sores, blood clots, or a chest infection. Every day, someone from your surgical team will check on how you're doing and will confirm the day they're planning to discharge you home. There are other members of staff, such as a specialist nurse from your surgical team, the pharmacist or dietitian who may also come and see you if required.
It's normal to have pain after any operation. We will give you painkillers to help you eat, drink, move around, breathe deeply, cough and be as comfortable as possible. If you have pain in the meantime, just let us know and we can give you some extra painkillers. Painkillers can cause side effects like constipation, so please let us know if you're suffering from any of these and we can help you deal with any side effects.
We'll try and remove any drips and drains on the day after surgery so you have less attached to you. Ideally, aim to get out of bed on the evening of surgery or at the latest for breakfast the next morning. You may be able to do this yourself or you may need some help. Try and get dressed into your own clothes. This will help you feel more like yourself and more confident when walking. Once getting up and walking becomes easier, start walking to the toilet. You need to try and walk around the ward yourself at least 4 times per day. If you're having difficulty walking or washing and dressing, you may see a physiotherapist or occupational therapist who will assess how you're getting on and how you'll manage at home after discharge. Evidence shows that the sooner you start eating and drinking, the better. You may want to bring in some snacks that you know you like. If you're having weight loss surgery or surgery on your bowels, there may be some restrictions to what you can eat. Check this with your surgical team. Even if you don't feel like it, try and eat to get your strength back. You may also be given some supplement drinks, which help with your recovery after your operation. Again, let us know if you feel sick and we can give you something to help. On our wards, there are protected times for meals and for rest during the day in order to help your recovery. Your relatives and friends will only be allowed onto the ward at visiting time and will be asked to leave at the end of this period. The other patients really appreciate everyone respecting these visiting times and staying as quiet as possible when they're on the ward. For example, keeping phones on silent. Ask your visitors to call the ward to check what time they can visit before they get to the hospital. The planning for you going home will start before you even come into hospital, and we want you to let us know any problems you may have afterwards. Each day on the ward, your expected day of discharge should be discussed with you, so you can plan when you're going home. Contact the person you asked to collect you after your surgery to keep them informed of the day you're going home. Make sure you have your house keys and clothes you'll feel comfortable in to travel home. Ask your family or a friend to get you some essentials: milk, bread, fruit and vegetables, for example. Make sure you take with you all your belongings, including any walking aid like a frame or a stick, any paperwork or anything else given to you by the team. If you're older or have problems managing independently, we have rehabilitation teams to assess and help you, both in hospital and at home, as well as other agencies such as Age UK, who can make the move from hospital to home much easier. If you have dressings to be changed, you'll be referred to the nurse at your GP surgery. The details will be on your discharge letter. We would like your thoughts on anything we did well or could do better. Before you leave the ward, you should be asked to fill out a survey. And after you've gone home, you can contact our PALS department to give any feedback. The sooner you get home, the sooner your real recovery can start. You'll be able to get much more sleep, peace and quiet, and you'll be able to eat your own food. If you have any concerns or queries, please get in touch with us.